Busy schedules, fear, and money, barriers that often keep women from getting a mammogram. Healthcare workers here in Nevada are trying to break down those barriers and make it easier for women to get screened. And they are the reasons why here at 13 Action News, we're committed to our 13 Connects community initiative called Tag Your It, a breast cancer awareness campaign in partnership with Nevada Health Centers.
This week's Tag Your It is encouraging a friend or loved one to get screened for breast cancer because early detection, as we know, is key. 13 Action News reporter Kelsey McFarland has a story of one Nevada woman who pushed past her fears.
Charlo Peterson was diagnosed with stage 1 breast cancer in September of last year. Looking back, she's grateful she made the appointment to catch it at stage 1. It took some persuasion from a friend and some financial help. Now she's sharing her story to show other women the importance of putting their health first.
It all started on a walk with a friend. Charlo Peterson was venting about some pain she'd been experiencing.
I was telling her that I had some lumps that were kind of irritating my left breast. And she says, well, you should go get that checked out. And I said, well, I don't have any insurance right now.
After some encouragement, Charlo made a phone call to Nevada Health Centers, only to find out her lack of insurance wasn't a problem.
Thank goodness I actually made the phone call.
Charlo got her mammogram inside the Mammo van, which tours around the state of Nevada. Program manager Rhonda Johnson says donors make it possible for women without insurance to get screened.
If it's a cost, we will work it out. We will get you that screening that you need.
Charlo was diagnosed with stage 1 breast cancer a few months after her visit.
I'm so grateful to them. It gets me a little emotional because if it wasn't for them, you know, I would have pushed it off and I'd be sitting here today with who knows what stage of breast cancer.
Another barrier women often face, fear. But Charlo says the process is not painful.
If you've never had a mammogram before, you've heard stories, I'm sure, from somebody that have said, oh, they smush you and, you know, it kind of hurts and it's uncomfortable. It was nothing like that. I mean, nothing like that. There was no pain. There was no discomfort. They were so gentle, the way they handle you and talk to you.
Rhonda says that's by design. They now use a curved plate to avoid any sharp edges or tugging.
It's not like it was for our grandmothers or our great-grandmothers.
Rhonda says women can also struggle to put themselves first, which acts as another barrier.
Women are caregivers. They give all their attention to families. They don't pay attention to themselves as much. And we are changing that message there to say, care about yourself.
The screening is quick, about 30 minutes total. Charlo, a single working mom, is happy she made time for it.
Don't wait, just go, 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 because it could be a worse scenario.
That 30-minute screening could save your life.
You're putting yourself in a better position, number one, and the most important, to survive, to go on and see your children grow, to see your great-grandchildren. So the early detection is what we go for. It's also the least invasive treatment. You're not going to go on for years. The fight's not going to be as hard.
Charlo is still in treatment now, but she got her mammogram for free, and every penny of her treatment, medication, and reconstruction surgery is also taken care of. That's because she applied to Nevada Medicaid for breast cancer. There are some eligibility requirements for that program, but if you're interested, we'll post links to information on our website at ktnv.com. I'm Kelsey McFarland, 13 Action News.